Welcome back to Oracle TV, and I am sitting next to Dr. Jigar Patel, who is Senior Director in Clinical Product Management at Oracle. Dr. Patel, thank you so much for being here.
Thank you for having me, Shanna.
And I have to tell you that your excitement is contagious. This excitement that you bring to every conversation, I love it so much, and I get excited for what you're going to say.
Thank you. I love my job. I tell people I was perfectly trained to do this job, and so the passion is real. I get excited about the work we do, and so I'm in a good spot for doing the things I do every day.
And I know that you've brought that here at HIMSS, and you're here specifically to take part in the interoperability showcase.
Yes, and so the interoperability showcase, one of the things that's obviously people are talking a lot more about is artificial intelligence.
Yeah.
And so in the interoperability showcase, we're going to talk about the influence or how interoperability and artificial intelligence will work together in the future, both on the front end of how do I formulate data to share, and then how do I consume data that is shared as well. And artificial intelligence and the ability to use a large language model to summarize and interpret and make accessible the information that there's so much of in healthcare is going to be game changing.
That's fantastic, and so I know that link, between AI and something that I think is an exciting piece of our future in healthcare. That's the clinical digital assistant.
Right.
Can you tell me more about that?
Yeah. So Oracle Health Clinical Digital Assistant was born out of prior to Oracle acquiring Cerner. Mr. Ellison got on stage and said, "We're going to voice enable the electronic medical record." And so the team I joined took that away and came back with Oracle Clinical Digital Assistant. And what they're doing with it is it's not just voice enabling the EMR, it's allowing voice to be captured and lower the burden of documentation and other aspects of care. So we're going to record the conversation between a doctor and a patient and turn that into a note for them so we can decrease the burden, decrease the amount of time and that they're in the electronic medical record, decrease the amount of documentation they do. It turns into an editing job as opposed to a creation job. So it actually lowers their cognitive burden as well. So this is, the technology is being applied in a way that can really make it easier for doctors to get through their day, see their patients, and really focus on the patients as well.
That's incredible. And what's the feedback we're getting? Are we getting any from physicians yet?
Yes, we are. So we have 8 clients live now, about 60 providers across the United States. They're all in family medicine, internal medicine, primary care clinics. And we're getting some great anecdotal feedback. We had one physician say, it's the end of my week, I have one patient left and I'm all caught up. That means I don't have to spend 3 hours tomorrow on Saturday finishing my notes. We had another physician say, for the first time in 6 months, I had lunch 3 times this week. Another got out of the clinic to go see a baseball game early. So there's a lot of great life experiences and other things that can be opened up, improve the life of a physician, decrease their burden, and really make it easier for them to get through their day. It's hard. Medicine is taxing, and taking care of people is hard. So we're doing a little bit to help them make that easier.
Yeah, that is pretty amazing to hear that feedback. And along with the physicians, we have to, follow something that they do so closely, and that's do no harm.
Yeah.
And so you have to believe that the clinical digital assistant is also providing an experience for the patient.
Yes, and for the patient, it's we've got other anecdotes like the doctor looked at me the whole visit.
Yeah.
They weren't buried behind a screen, or they weren't turned to the screen.
It's the interaction.
Yeah, it was very much, and it is, the interaction is the right word, because fundamentally medicine is an interaction, and people share very sensitive things with physicians, and they put their trust in us. And to be able to push aside the technology and focus on the person that's in front of you is really what most people went into medicine to do.
Absolutely.
And it's so core, and we've gotten away from that in part because we we should digitize the record, but it's also taken away from the interaction. So we're getting back to a more human experience, which is really important as well.
Yeah, it's really, that power of eye contact between
Yes.
a provider and a patient.
Yes.
I mean, that's magic,
Yeah,
I think, right
it
there.
is. And I took a bunch of engineers to visit a client, and they were surprised at the number of times a physician actually took their PC or their laptop and pushed it aside because they knew they had to interact with the person, because it was a difficult conversation. It was something, we who are trained in medicine, we do it every day, but the person in front of us, this is the only time they're going through their health condition. And so to have someone be able to relate to you in that moment means everything.
Yeah.
And just really, it brings the humanity back to medicine a bit.
Absolutely, to be seen, to be heard, to be valued.
Right,
I mean,
correct.
That's pretty incredible. So when you think about the evolution of the clinical digital assistant, what
Yes.
is that?
Yeah, so the evolution is the most exciting part, actually. I don't get to talk about it a lot because we're still going through the plans and creating it, but the backbone of the future electronic medical record will have Oracle Clinical Digital Assistant at its heart. So whatever form factor you're on, whether it's your mobile device, tablet, laptop, desktop, you're going to have voice enablement. We're going to have AI listening to the conversation, helping you create that note, actually helping to create actions out of the conversation. So what orders does the patient need? What things need to be added to the record for completeness? Those sorts of things we're going to get to. And then transforming, the other thing that's key to Oracle Clinical Digital Assistant is a conversational experience with the device. And that will become core to the electronic record of the future as well. I've told people I got to come up with a better name for it, because I don't think it's going to be electronic health record anymore. It's going to be something completely new and different. And we got to get some marketing folks on helping me out to figure out what that should be.
I love that. That almost feels like a challenge.
Yes,
so put
it
in
is.
the comments if you have
a
any
challenge.
thoughts on that. I actually love that.
Yes.
And so just really quickly, to wrap this up, you mentioned that we have 8 customers.
Correct.
What's our future look like?
Yeah, so in the short term, in the next month, I have 5 more customers that'll be entering our beta program. So we're not generally available with the software yet, but we're doing, I think, a really good job of getting a lot of feedback from a lot of places all across the United States to make sure we're meeting the needs of clinicians wherever they are. We're going to be generally available in June timeframe. And then after that, I've started to talk to folks in the UK, in Australia, in Canada, the Middle East. So we have to think about other languages, other ways of practicing medicine, and how we can help them lower their burden from a documentation perspective, help them focus back on the patient, and make that conversation more human again. So it's a very exciting time to be working here in this space, because I get to talk to a lot of folks, I get to go to a lot of places, and it's not just here in the United States, it's all over the world.
Well, I'm here to match your hype in healthcare. It's exciting to look and to think about our future ahead as leaders in this industry.
Yes,
Thank you so much for your time today, Dr. Patel. It has been a joy to talk with you. And we will be back with our final interview with Linda Reed from St. Joseph's Health.